As a GP, I see firsthand how chest infections pose a prevalent and significant problem for many of my patients throughout the year, but these respiratory infections are most common during the winter months, and waiting rooms across the country start to fill up with coughs and sniffles. Chest infections can stem from various microorganisms, including viruses, bacteria, fungi, environmental irritants, and allergies. Common causes include viruses like the common cold and the flu, bacterial infections like pneumonia and bronchitis, fungal infections like aspergillus and candida, and exposure to irritants like cigarette smoke and air pollution. During the winter months, we spend more time indoors and on crowded public transport, and this increased contact can heighten our risk of exposure to respiratory infections. On top of that, the cold air can cause our airways to constrict, making breathing more challenging and increasing the susceptibility to infections. And the lower humidity levels during autumn and winter with the dry cold air can actually dry out our mucous membranes in our nose and our throat, making them more susceptible to infection too. And as we all know, winter also coincides with the flu season, which can result in complications such as pneumonia. And all of this results in an almost perfect storm for chest infections and misery for the UK. If you can recognise the signs of a chest infection, you can seek prompt medical attention faster. The earlier we get a diagnosis, the sooner we can start appropriate treatment to help prevent any complications and improve your quality of life. The warning signs can include a persistent cough, often producing sputum or phlegm, the shortness of breath, chest pain, tightness, fevers, chills, fatigue, and general weakness. It's worth noting that public transport during winter months can contribute to the spread of respiratory infections, including chest infections. And a study conducted by Public Health England found that individuals who regularly commute on public transport are up to 6 times more likely to catch respiratory infections than those who do not use public transport frequently. Buses, trains, and aeroplanes are enclosed spaces where we are often jammed together, and that contributes to the transmitting of viruses and bacteria. And additionally, the recirculated air within these vehicles can also increase the risk of transmission. So what can you do if you do have to take public transport to reduce your risks? Wash your hands frequently with soap and water, or use a hand sanitizer. Avoid touching your face, particularly your eyes, nose and mouth, as these are entry points for germs. Cover your mouth and nose with a tissue or sleeve when you're coughing or sneezing. Wear a mask to help prevent the spread of respiratory infections. And consider avoiding peak hours on public transport to minimise exposure to large crowds. If you do experience symptoms of a chest infection during the winter, there are several things you can do to try and alleviate the discomfort and expedite the recovery. Drink fluids like water, tea, broth to help loosen the mucus and also prevent dehydration. Get adequate rest to support your body's fight against that infection and promote healing. Use a humidifier to add moisture to the air, which can alleviate the cough and congestion. Steer clear of smoke and other irritants like air pollution and chemical fumes, which can exacerbate your symptoms. Eat a healthy and balanced diet to support your immune system. Try over-the-counter medications like pain relievers and suppressants to help with the fever, coughing and sore throats. And if there is a bacterial infection as the underlying cause, your GP may want to prescribe antibiotics.